So, with that as an introduction, what are your choices for building a family now that your cancer treatment is over? Well, certainly many women will be able to get pregnant naturally after treatment. We generally recommend that women wait at least 1 to 2 years after treatment, and this is something that you should really check with your oncologist to see how long they recommend that you wait. Now, the reason that we recommend waiting a period of time, actually there's several reasons. One is we want to make sure you've fully recovered from your treatment. Second, we want to make sure that you're well enough to know that you're not going to need any further treatment. You wouldn't want to be pregnant and then have to consider chemotherapy. It's also really important to allow time for any eggs that may have been damaged from the treatment to be cleared from the body. And finally, there has been some research done looking at the health of children born from parents who have had chemotherapy compared to the health of children born from the general population. And we know that in the general population, about 3 to 4% of babies will be born with some health problem. And when we compare this to babies born from parents who have had chemotherapy, we see that this is exactly the same. But all of these parents waited at least a year after cancer treatment. So it's somewhat reassuring for us to know that waiting that year will increase the likelihood that you're going to have a healthy baby. Now, generally, people are told that they should try to get pregnant for a full 12 months before seeking help. If you've had treatment for cancer, we recommend that you think about getting help if you've been unsuccessful after 3 to 6 months, because you may have a harder time normally and you're getting older and you don't want to delay any longer than you need to try to intervene. So if you're not successful after 3 to 6 months, we recommend that you schedule a consultation with a reproductive endocrinologist. These are basically gynecologists who have special expertise in fertility. Now, what they'll do is ovarian reserve testing. They'll do the tests I mentioned earlier to evaluate your fertility. Then, depending on the results, they may recommend that you use frozen eggs or embryos that you might have collected before you began treatment, or they may recommend that you undergo ovarian stimulation with in vitro fertilization, IVF. And so I'm going to walk you through what's involved with that. Now, if you remember, I mentioned earlier that each month with the menstrual cycle, only 1 egg fully matures. So if a woman is having a hard time getting pregnant and she's considering IVF, we want to try to collect as many eggs as possible. So the first part of the process is to stimulate the ovary so that multiple eggs will mature simultaneously. And here you can see a picture of what the ovary looks like with multiple large follicles. Those are the black circles that you see in the ovary. Now, during the period of stimulation, you'll actually be monitored every day by the reproductive endocrinologist. This takes about 9 to 14 days. And what they're going to do is monitor the size of the follicles so that they can see when the eggs are fully mature. And when they are, they'll schedule you to come in for the retrieval. Now, the retrieval is done in an operating room under anesthesia. The whole procedure only takes about 20 minutes, however. And what's involved is passing a very thin needle through the wall of the vagina to puncture the follicles in the ovaries and withdraw all the fluid, and that's how they basically pull the eggs out of the follicles. So they empty all the follicles on one ovary, and then they pull the needle out and they empty all the follicles in the other ovary. And as I said earlier, this only takes about 20 minutes and you're sound asleep under anesthesia. The eggs are then brought to the laboratory where they're fertilized. In vitro means in the laboratory, so that's what in vitro fertilization is. Now, the eggs can be fertilized in one of 2 ways. They can take the egg and combine it with thousands of sperm and just let the sperm fertilize naturally. Or they can use a procedure called ICSI, intracytoplasmic sperm injection, to take a single sperm and inject it into the egg. And this may improve the number of eggs that actually get fertilized. Once the egg is fertilized, it's kept in the laboratory for several days so they can watch the embryo grow and develop to make sure it's healthy. And then they take 1 or 2 embryos and transfer it into your uterus. And I'm just going to show you how that's done here. They pull up 1 or 2 embryos into the catheter, and they then pass the catheter through the vagina, through the cervix, into the uterus. They release the embryos and then take the catheter out. All of this is done in the exam room. No anesthesia is required. It's very, very quick and it's painless. Once the embryos have been transferred, they'll have you come back in about a week to have a blood test to see if you're actually pregnant. Now, ovarian stimulation with IVF is rather costly. The medications to stimulate the ovaries are between $4,000 and $5,000. The daily monitoring, the retrieval, and the fertilization cost about $10,000 to $12,000, and then the transfer procedure is about $4,000. If you have any extra embryos, they'll be frozen and stored for you to use in the future with additional attempts at pregnancy if you want more children. Now, if you get pregnant, either naturally or through IVF, we recommend that you consider seeing a maternal fetal medicine specialist. These are obstetricians who work with patients who are at high risk. Now, you may have gone through your treatment without any problems and not have any side effects at this point, but we do know that cancer therapy can cause some latent problems that can become manifest at times of stress, for example, the stress of pregnancy. And so because of the possibility of problems with heart, lung, kidney, or liver problems, perhaps some hormonal disorders from treatment or changes in the uterus, we recommend that you consider seeking care with a maternal fetal medicine specialist.